good to have you with us on this edition of the Urban Debate. Viewers, even though most states are yet to see the peak in COVID cases, all are hoping to hit the peak in COVID cases by end of August and first week of September. Even though the country as a whole hasn't really seen a peak in COVID cases, we have significantly unlocked, and that's fine, because at the end of the day, viewers, the lockdown was supposed to help us prepare. The lockdown was supposed to help spread awareness, supposed to help us take precautions, get our masks, gloves, sanitizers, healthcare infrastructure, ventilators, additional beds, support staff, healthcare staff in place. That was the idea, so that when the cases peak, we should be ready. So tonight I want to talk about the next phase of easing of restrictions and to what extent can we do it and what should be the precautions that we take. And I'm going to talk about one state that has significantly now lifted the restrictions, and that is the state of Karnataka. And this is the latest one to do it. Many of these rules have already been implemented by other states, though states like Maharashtra are still very, very conservative and careful. But what about Karnataka? Well, the state of Karnataka has now allowed yoga centers, gymnasiums, they've allowed malls to function, all places of worship can function, sports complex open only for players as per the central guidelines. They've opened restaurants for dine-in, not just for takeaway. In fact, we are given to understand that the state is also mulling reopening of pubs come the month of September. What is not allowed as per the central guidelines, and Karnataka is following that? Schools, colleges, coaching institutes remain shut. Metro services, theatres, swimming pools, entertainment parks remain shut. Auditorium halls, large social, political, academic functions remain shut. Now, the other significant change for the state of Karnataka has been for travel. Up till now, they had the rule that if you arrive in the state of Karnataka, you have to mandatorily quarantine yourself, home quarantine is fine, for 14 days. Now, that's not, the registration is not mandatory. All you have to do is report that you have come into this state, and that's that. So the travel restrictions have been lifted. Interstate, intrastate travel is being made easier. Will the other states follow? And I say this because today we had even the finance minister raise the issue that for the sake of economy and business, it's important that we do not restrict the movement. We need to have easy flowing movement of goods, trucks, suppliers, vendors, people across the country to start boosting and reviving our economy. Can we do that? Can some of the other states do that? How far away are these crucial states? Because, for example, let's take a look at our COVID curves. Before I go to our panelists, take a look at the COVID situation for the state of Maharashtra. Maharashtra registered about 6,15,477 cases as of August 18th. As of August 24th, the cases have gone up to 6.9 lakh. We'll go to the other states in just a bit, but keep in mind that the cases are still on the rise. For some, the pace is faster. For the other, the pace is slower. And that's what it is. Let's say good evening to the panelists who are joining us. The simple question I'm asking is, to what extent can we ease the movement of people, the movement of goods across states, across districts? To what extent can we open up our centers, dine in restaurants, shopping in our malls? Are we ready for that kind of a setup to restart our economy as well? Let's say good evening to AMRISH ARORA, member of the National Restaurant Association of India and part of the Managing Committee for Hotel and Restaurant Association. Dr. ANANT, researcher, global health, bioethics and health policy. Clyde Crasto of the NCP and Kovai Sathyan of the AIADMK. I also have Vivek Reddy joining us from BJP Karnataka, and Mr. Suresh Khosla, Managing Committee member of the All India Motor Transport Congress. Now, you will see, viewers, we have a good mix of some business representatives and political representatives and healthcare. because any policy, whether by a state or by the center, has to factor in all these aspects and then be decided on. So actually, let me start off with Vivek Reddy, because Karnataka is the one that's leading the unlocking, Vivek. Restaurant dine-ins for one, and of course, you know, the mandatory quarantine now taken away. Interesting steps. What was the, you know, conversation, the rationale before we decided on this?
Well, I think, Tanvi, the whole issue was that the first 2 or 3 months of lockdown, these were heavy clampdowns with restriction of movement, sealing of interdistrict borders, and complete lockout of the state. I think the first 1.5 months, we witnessed that throughout India. Then we saw easing of restrictions, semi-easing of restrictions, but which were quite strict. So the first 3 months were spent while we were in lockdown. We were preparing for, there was COVID preparedness that was going on in all fronts. Now that we are ready, it doesn't mean that we have to expose ourselves. People are sensitized to it. The question is for even state governments, how long can they run these wholesome lockdowns, or how long can they, allow free up little parts of the economy in order to ensure that the economy resuscitates? Ultimately, if the economy does not resuscitate, people have to live, people have to earn, and salaries is something that is very important. If we go in for lockdowns, I think the service industry will be the hardest hit. So therefore, the government of Karnataka has looked at the emerging situation in COVID and has planned it accordingly and is ensuring that, a balance is there between COVID preparedness, COVID caution, and the opening of the economy. Ultimately, we are in sync with the nation with not opening of schools. We are in sync with the nation with not opening of several other sectors. That is because there is the direction of the central government. The other sectors which are available, I think we have freed it up to a little extent so that even if restaurants are open, we have said that dining should be at least only with 2 a table. It is not with 4 a table. So these restrictions are mandatorily followed by the restaurants in Karnataka. This is how we have gone about it. When we go to malls, we see people themselves are less. The malls are not filled with people now because people are also wary of the situation. So within the limited alternatives available, I think the government has done a fairly good job in striking a balance, because Bangalore has a mix of a lot of people coming from outside the state who are dependent on salaries. And this is over the past 2 decades, we have seen, those who have been in Bangalore and those who are used to Bangalore have seen that the number of people dependent on the monthly salaries arises out of the service industry. And if we lock down the service industry, that is going to be hit, and it will directly affect people and their ability to put bread on the table. So therefore, this was one of the key considerations for the state, and it is doing fine. And COVID also is quite, though there are cases every day, there are at least about 2,000 and odd cases, 2,500 odd cases reported from Bangalore every day. We are ensuring that it is stopped at that level. There is no rush to the hospitals, and the hospitals are taking care of patients.
Very simply put, Vivek Reddy, the last time Karnataka decided to open restaurants, and I believe that was a couple of months ago, if I'm not mistaken, we had some, at that point, we were not allowed to step out anywhere in the rest of the country, and we had some amazing visuals of dosa centers opening up in Bengaluru and people going in to eat. We saw a spike in cases, and then everything was shut down, and we went back. Now, how is it going to be different this time?
Well, I think if you look at the 10-day lockdown that we had in July, I think after that, when there was some spike in cases, after that we have seen that though we have opened up, the spike is not there. We have somewhat stabilized at about 2,500 cases a day, and most of them are asymptomatic or mildly symptomatic. We have made provisions for people to get quarantined at home. And most of the Bangalore cases have been home quarantines, and they have been released with the endorsement of the local BBMP officials, corporation officials, Mahanagarapalika officials. So therefore, there is a acute monitoring, a severe system of monitoring. Along with that, extreme cases are well taken care of with the nursing home infrastructure and the government infrastructure. I think we have done fairly bit, though we have loosened it up. And that's where Karnataka is excelling and shows quite a different situation from other parts of the country. Therefore, some risk was to be taken with respect to opening up the economy. for the purposes of limited sectors, for the purposes of enabling people to earn their lives and to earn their bread.
Okay. All right. Clyde Crasto wants to come in. In the state of Maharashtra, we don't have dine-ins right now, and I think the state has also indicated that they will wait a while longer before even opening for easy inter-district travel. Why is that, Clyde?
Yeah, see, I'll tell you something, Tanvi. We are political spokesperson, and Vivek, Reddy, and I can keep arguing about a lot of things, but that's not the point here right now. The kind of situation that we're going through, at the end of the day, we all human beings. Also, I can understand what Vivek Reddy is saying about the economy and how things have not been panning out. Besides economics, also I understand the mental state of cooped up at home, not being able to go out. So a lot of issues. I mean, some of the doctors can throw a lot of light on this. But I'll tell you something. We need to tread very carefully. Like you told a little while ago, Bangalore opened up a little while ago, and then you see the spike in cases that happened. So I mean, I can only wish them all the best, that I hope it does not happen, the repeat of what happened earlier. But when it comes to Maharashtra, let me tell you, we are treading very carefully. Now, if Bangalore is looking at cases like 2,000, 2,500 cases that is going on, I can understand, it's kind of at some level, but it has to come down. So that is what we are trying here in Maharashtra. That is what we are trying here in Mumbai. Now, Mumbai, yesterday we've come down to around 700 odd cases. The growth rate is only 0.79%. Then the doubling days have gone to 88 days, and the recovery rate's gone up to 81%. So there are good signs. The good signs that the things are changing, things are looking better. In Maharashtra now there is 73% recovery. So it's not that it's a complete shutdown. There can never be a complete shutdown. Last couple of months, the Honorable Chief Minister has been talking, Deputy Chief Minister has been talking how we are opening up slowly, whether it's like private offices opening up slowly or government offices opening up slowly, even the malls for that matter. Malls have opened up with a lot of norms that have been kept. The social distancing norms are in place. Theaters cannot open, restaurants cannot open, because we don't want to jump into this. I understand the economy is in trouble, people are having a lot of problems, I understand. But if you are safe, if you can stay away from this pandemic, then probably as it opens up, you can come out and start getting your life back in order. So I think whether it's Bangalore or Maharashtra or Delhi, anywhere, even the central government for that matter, I think we need to really, really think about it carefully as to how we start opening up things. See, the Chief Minister a couple of days back said the same thing, that I cannot jeopardize the life of people just for the sake of economy. Yes, economy is very important, but the lives of people are much, much more important. So when we are opening up, we will open up slowly and carefully. And yeah, I mean, look at now, today is the 25th, 31st, the lockdown is supposed to end. There'll be a new set of guidelines which will open up, makes things more easily. So I think we need to keep an open mind about this. We need to be very careful about this. Okay. And whether it's any part of the state, any part of the country, the states along with the central government should work together only for people. And if there has to be certain restriction, I think it should be there, because at the end of it all, we are all going to come out of this safe. And I wish and pray that we all come out very safely.
Yes, which is why I feel that even the center has given the freedom and the decision making power to the states in case they want to tighten the norms. Yes. And then not for dilution, but tightening of the norms depending on the situation is the power with the states. Very quickly, let's bring in Kovai Sathyan as well, from AIADMK, about what's happening in Tamil Nadu. Kovai, to what extent is this state ready to open up? Because a lot of inter-district travel that took place led to the spread of the infection, and then you had shut down those barriers. Where do you stand today?
The norms were simplified in the last 3 days. So people who apply for the e-passes will immediately be sanctioned, provided they give their Aadhaar card details, because it's easier for us to track down where are they and how are they been traveling. But with that kind of setup, the number of people who flocked in Chennai in the last 2 days are about 79,000. Now they are being monitored. So we need to have a synchronized common mechanism if we are opening interstate as per the norms of MEA. We need to have a common mechanism where the data can be spooled at one common center and can be shared with all the states. I'm not sure whether the central government has got this kind of a setup. Why predominantly? Because this COVID has spread because of people coming into this country and people traveling from one place to another. No state will have a mechanism to track each and every individual. We have tried the geofencing, we have tried geotagging using the mobile telecom companies and using their phones. We tracked all the movements. Mobile applications were launched. All are there. But still, you know that as long as the individual responsibility is there, it is pretty much difficult to track these people. And the point second is, with the kind of setup in the last 5 months, the healthcare system has reached to a point where it is able to manage the load of COVID patients. Today, if there are 6,000 cases positive in Tamil Nadu, 4,500 to 5,000 people get discharged, which means that the input is now matching the output with some close to about 75%. But if there is a sudden spurt in this state and interdistrict, definitely it is going to put a lot of stress and pressure on the healthcare ecosystem. So we have to carefully monitor and weigh whether the state government is really prepared to provide the healthcare to the last mile into the last village or last district, which eventually is a very big challenge for any state for that matter. Even though Tamil Nadu leads in healthcare system, we
So let me
ourselves
ask you
have.
this. Let me ask you this question, Kovai. Tamil Nadu has a large set of industrial zones, and hubs.
Yes.
While a lot of industrial activity has been allowed, what's been the sense on ground? Has that led to a problem in those areas?
No, there has been a good amount of awareness with the entrepreneurs, with the business people, as well as with the industrial fraternity as well. So they have taken a lot of cautious effort when the norms were eased. Initially, it was 30% of manpower, and then it was moved to 50% of manpower currently. So we believe that the ecosystem has cooperated well with respect to these kinds of measures taken by the government. But giving them the 100% operation and efficiency will have its own plus and merits. Because moment you ease down the norms of travel without having any tight monitoring facility. Monitoring, I meant that we need to know who is traveling where and what is his status quo right now. So that is what we are trying to convey. So until unless we have that, it will be pretty much difficult for the state to manage the show in the coming months when we give a free run for the people to move around.
Okay, let's bring in our other experts as well. And I want to actually start off with Dr. Anand Bhan. Dr. Anand Bhan, to what extent should the states and the cities be looking at opening up to that? If we compare ourselves to where many of the Western countries are, we are still a lot more cautious and restricted in our movement. But are we ready to move to the next stage?
Thank you, Tanvi, for having me. So, we are now almost 5 months since we started this whole phase of lockdowns. Somewhere around this time in March was when the first extensive lockdown was announced. And at some point of time, I think, states, the central government, people all got, tired of being in lockdown. And that's when the unlock phases started. What we've also seen with the unlock phases is a rapid rise in the number of cases, both number of cases as well as deaths. So, I mean, it's clearly true for almost all parts of the country that we know that the rapid rise in the number of cases have all happened during the unlock phase. Now, there is a fine line between ensuring that public health measures need to be taken, which is certainly the case for a pandemic, and ensuring that there is economic revival. I mean, no one would disagree with that. And I think, we also all know that you cannot be in perennial lockdown. It's not going to be a solution in any way. But that having been said, any unlock depends on a few factors. One is a strong governance mechanism and a strong reliance on individual responsibility. Unless you have fidelity of public health measures, which is usage of masks, physical distancing, hand hygiene, etc., at the individual level, any unlock phase will be a potential failure and could actually see a rapid increase in the number of cases. And you need compliance. And for compliance, then you need to figure out what is the right method. Is the right method one of policing, where you have police checkpoints and people being fined if they don't use masks, etc., or there is one of community championship and community ownership. And it seems to be the case clearly that the latter seems to work better. If you look at evidence from Northeast India, from Kerala, etc., where if there is community championship of the idea of following all of these norms, it works better. So, we all keep talking about the economy, but we're not really talking about how do we ensure that in the unlock phase, a cautionary note is something which is still followed both by the administration as well as by those whose lives are at stake here, which is the ordinary citizens of this country or of any state for that matter. The other thing to remember is, as you were pointing out, there are many other Western countries who've also maybe had a more liberal outlook, but they've also been very much looking out at the data very closely. So New Zealand is a good example. Auckland right now has been in lockdown since the 12th of August. Because they saw a cluster of cases, much relatively lower than the numbers we are talking about for the cities in India. But they went into lockdown and they've been in lockdown for the last almost 2 weeks now, because they realized that it's not worth the risk if you see a cluster of cases which could potentially lead to a citywide spread of disease and then a national spread of disease. So I think that's the kind of information which we need to be on top of. I think it's okay to try some experiments, take some risks as was described. But if that could lead to a actual rapid rise in the number of cases in any city, state, or at a national level, then we could be putting our health system at risk. We've already seen many parts of the country where the health system is already fragile, is treading a thin line in terms of being stretched. And that is the kind of risk we should not be taking. Mumbai has gone through that. Many other parts of Maharashtra have gone through that. We've seen those challenges in many other urban parts of India. So as we are trying to control this pandemic, it's extremely important that these steps about unlocking be taken very carefully. And then, an important part is then judging what is okay and what is not.
Right.
So, allowing for open spaces and economic activities in open spaces is generally relatively a better choice.
Right.
But anything which involves, closed spaces with poor ventilation could be putting people at risk. So I think that's the kind of things we need to be talking about. What is the right way to start if you want to start some of these economic activities?
Okay, let me actually bring in AMRISH Arora here. AMRISH Arora, because a lot of the conversation is about the hospitality industry that has really been one of the worst hit sectors, completely down and out, and somehow helping this specific industry, opening restaurants not just for delivery, but some kind of a dine-in. Now, how do we ensure? Clyde, I'll come to you. Let me just go to the two guests who haven't made a point so far. AMRISH Arora, how do we ensure that the restaurants are actually able to implement the COVID rules?
Thank you, Tanvi, for having me here. The panelists here are pretty much on sync in what they're saying, especially the first panelist, Mr. Reddy. He said what he said, and I laud Karnataka government for taking the step. And what I'm hearing essentially is self-regulation, individual responsibility. I think it's time we stop over controlling this situation, over monitoring it. Like one panelist said, even if we open the malls, there are not enough people coming in. So everybody is scared for their lives. So open up everything, let everybody self-regulate, self-monitor, let us have guidelines, let's not have Inspector Raj, let's our restaurant association fine us, not the other way around. We don't need that, because if we are living in a civilized society, you're asking the question, how will we do it? I am giving you the answer. This is how we should do it. We should self-regulate. We should trust the people. If the people are not of the strata that they don't understand something, fine. You can use your lathi and seeing on television, YouTubes and all that happening. But I feel the key factor here is self-regulation, individual responsibility, letting the restaurants open for the proper, not this till 7 p.m. That makes no sense. We need our alcohol. We need it to be open till the license period so we can stretch out the time. So some of the things are working cross purposes. So I see Tamil Nadu saying till 7 o'clock. I mean, who eats dinner at 7?
Right.
Go out at 7. Allowed. And trust us, for heaven's sake. I mean, let us, we are human beings and citizens of this country, and there are laws in place. If you only show this monitor rule and control rule, I mean, we are at one hand talking about economy coming back. Economy is not coming back if you don't let it come back. So stop controlling it.
Okay, let it come back. Stop controlling it. Clyde, do you want to respond to that before I go to our final guest?
Thank you for letting me speak. See, I completely understand what the gentleman was saying, and I'll also like to put together what Dr. BHAN I think said was saying. See, my point is very simple. There are two sets of people. Okay, there was a whole question about when the MHA said that interdistrict or interstate travel should be allowed, and there was a question raised when Maharashtra said we're going to discuss it and we're going to keep it on hold right now, not let it go so freely. Now there are two sets of people. One set of people understand the responsibility; they don't need to be told. They understand the magnitude of this pandemic, and there's another set of people who know what this problem is, but they still take life very, carelessly or very freely. Now, how do you identify these people? The only way to identify these people is to put certain restrictions and rules in place. And those restrictions and rules are only for the benefit of the people. Now, I think the earlier gentleman, with all due respect to him, he said, why do we have Inspector Raj? But if something goes wrong, then, you can have the Lathi. But then, if now you are talking about the Inspector Raj, there are a whole set of people who's talking about the Lathi Raj. So something or the other is going to come back. So the best way to do this is to understand both sides of people. One side that understands the morality and understands what their duties are. The other set who does not understand. So we need to have restrictions. Now you cannot demarcate this. How do you demarcate it? The only way to demarcate is to put these rules together. Let them come out in the open, and then you let them go through e-passes or allow them through permission. So I think a lot of states, many of the states that have done these things have actually controlled this whole pandemic. Just imagine if we had not done whatever we did, or if Maharashtra didn't have the restrictions, the cases would have been much higher. So I understand everybody's problem. I understand what the gentleman said. I understand what the doctor said, but we have to look at people from their mindsets. And these mindsets that are carefree need to have restrictions. The other set, they're doing a very good job because they understand the responsibility. But we need to put our minds together, everybody. It's not just me or you. Every person, everybody from every sector has to put their minds together and slowly and steadily open this and fight this pandemic together.
Okay, let me bring in, Amrish, I know you want to make a point, but let me also bring in Suresh Khosla. He's patiently heard everybody out. Mr. Suresh Khosla, thank you for joining us. The last time we spoke, obviously, the transport sector had been completely shut down. We were in the middle of the most stringent lockdown we had seen. What's the situation today? Do you believe, Mr. Khosla, we can open up more now?
Yeah, good evening, Tanvi. I have heard patiently to all the panelists with me. See, today, our industry, we are in the moving stage, right? Today, the engine has started and the manufacturing units are not completely working. It is, we have achieved 40%. But as on date, we are still having the problem with respect to drivers, with respect to laborers, and wherever the vehicles are going, whether it is at the loading or unloading stations, there is a detention where we are not getting proper loads. Why we are not getting proper loads? Because there is no, the manufacturing units are, they are still, they are opening up. It is not completely, they have opened up.
Ask you this question, Mr. Suresh Khosla. Now that significant amount of transport travel is being allowed and different states have different rules, how does that hamper business? How does it make your life difficult if you have to transport something from, say, a manufacturing facility in Gurugram or somewhere in Haryana, in Manesar, and bring it down to a place in Maharashtra, or even movement-wise? Are there still some difficulties in crossing these barriers?
See, number one, as rightly said, there is a fear factor. There is a fear factor. And with respect to the logistics sector, we have been demanding that we want a COVID insurance for the drivers. Till date, we haven't got any support from the government to our industry, to our logistics sectors. We haven't got any support from the government. And there are certain challenges because there are no laborers which are available. And the drivers, there is a shortage of drivers. Yeah, en route, initially there were dhabas which were closed down. At en route, we are not facing any problem. All precaution measures we are taking with respect to sanitization of drivers, the vehicles.
Well, this is the other aspect, the fact that there is one sector which has also been badly hit, just like the hospitality sector, and that amount of support hasn't come in. But when we talk about movement within the states and then between different states, Clyde, my question to you is, if we are all right with people traveling in state transport without an e-pass, then why are we insisting on e-pass for private vehicles, which would be safer than actually being in public transport?
No, you have to understand, Tanvi, the state transport buses are regulated. The social distancing is maintained in those buses. When they board the buses, a clear set of guidelines have been given to them, and there is a monitoring system. People who are sitting in the bus, there's a limited number of persons allowed in a bus. When you take a private car, you never know how many people are going to sit in there. There's no possibility of social distancing in that. So that is the reason why specifically state transport buses, not even private buses, are allowed. Because again, the rules could be flouted in a private bus. The state transport mechanism is monitored by the government. And that's why it is being allowed. So you have to understand. So like we've been talking, we are trying to open this up slowly and steadily so people have some breather in this whole situation. Like we had the Ganesh Utsav that is going on right now. So therefore we opened it up a little. But also because the inter-district or interstate transport had started off, there have been cases in the rise. So we have to kind of sort of nip it in the bud. We could not do it in time earlier. So the whole country was suddenly taken by storm with this whole thing. So now that we've understood what is happening, now that we understood what the problem zones are, we are working on that. So I think it's a right step in the right direction. And again, like I said earlier, what I said to you earlier was that we will slowly open it up a little more, but monitoring by the state machinery, by the state, which is their responsibility. And I think Maharashtra government is doing a very, very commendable and good job in holding the responsibility together. And that's what we are doing. So I think people should bear this for some time. It's because it's only for their good.
Okay, Vivek, Reddy, does that make sense? If you have public transport, even with social distancing, you still are restricting people's own private vehicle movement between districts?
Well, I think that must be the case in Maharashtra. We also tried that out in Karnataka. But the system, what I'd like to remind Clyde is that you can't use one standard thumb of the rule for the whole nation. Perhaps you have to look into the local factors also.
Yes, exactly.
It's not a So therefore,
exactly, I agree with you.
Maharashtra's case is one of I wouldn't call it mismanagement. One management module where COVID went rampant and wild. Initially, it led the nation, and thereafter it was brought under containment. So that is Maharashtra's scenario. Karnataka's scenario is that where it was contained very well initially, but the virus went after that containment. So, the virus is not fully loose in Karnataka. So you have different scenarios. But in the scenario that Maharashtra is facing, perhaps the inter-district rule, we did that in Karnataka. The inter-district rule was put in place. There were curbs on transport inter-district, which prevented COVID from traveling between different districts. But I think in a scenario where you have the economy being loosened up in the whole of the country, inter-district restriction will ultimately affect the economy. What we are seeing, Tanvi, throughout India today is that many sectors don't have the personnel, the men and material. There is a lot of vacuum and void spaces which are to be filled up in the chain of manufacturing, in the chain of service industry. There are so many gaps in between that for these people to come back, we must have some free time for the economy to take, to ignite. Now, if we don't start doing it now, I don't think the economy will come back anytime soon. So, so long as you continue these gaps, it's a very difficult scenario. So Maharashtra today may be trying to contain the original mismanagement or the original rampant spread. But again, I wonder whether this is in sync with the nation's economy going faster.
Okay, I just want to point out, yes, Clyde, I know where you want to respond, but I just want to point out, let's not forget, the entire country is projected to have a negative 4.5% growth. So I
Yes.
understand that why at least the
No, I'll
BJP
tell you a
governed
quick
states
reply.
are a little concerned about where the economy is finally going. Yes, Clyde.
Let quickly tell you. See, it's very strange that a part of what Vivek Reddy said is I agree with it, because it's very strange that me agreeing with Vivek Reddy, which is
Yeah,
like
he started
unlikely.
off on a very
But let me tell you-
cooperative note, and then slyly there was one jive that came in, Clyde, about how you mismanaged in the beginning.
That's what I'm trying to tell you. See, let me tell Vivek Reddy something. I'm sure Vivek Reddy is, doing his job. Let me tell you one more thing, Mr. Reddy. There are two things he said. I couldn't agree with you more than this, that, each state has to take the local decision. That's exactly what we've been trying to say from day one, that the center can give the guidelines, but we need to go with the local situation, what the local situation is. Secondly, when Mr. Reddy talks about mismanagement, let me tell you, the major amount of international travelers landed in Mumbai right in the beginning. Therefore, Mumbai took the brunt of the whole pandemic. That's why Maharashtra took the brunt of the whole pandemic. So I think everybody needs to get their facts together. The international travelers came into Mumbai city first, and that's where it started from. Secondly, when you say that inter-district, travel is going to restrict, to put the economy down, let me tell you there are two different words. One is regulated and one is restricted. We are regulating the movement. We are not completely, like a blanket stop from inter-district travels or blanket stop on interstate travels. It is being regulated. When I say the ST bus, they're social distancing, and the private cars not allowed. It's not that the private cars are not allowed. They are allowed, but they need to go through a process. They need to get an e-pass. That's where the regulation comes in. This is not restriction. This is regulation, because I'll tell you something, Mr. Reddy. You have opened up Bangalore to Karnataka for people to come in. What if we do not check on the people coming into Karnataka? What if a few people who are already asymptomatic, but they end up having the COVID-19 virus in them? If they land into Karnataka, how is it going to work for you? Because there are people from here who are going to take the virus into your state, and it gets even worse there. So you should be thankful for us that despite you allowing people coming into Karnataka, we are going to make sure that they go after they are checked, after they take an e-pass, after they are regulated. So I think it's a very sensible thing done by the Maharashtra government, that we are checking whether other state allows them or not. But we are going to make sure that we don't send you a virus from here. And that's how
Can
we're
I
going
just
to make
come in?
sure
Just
that the
one
Yes,
country
response.
comes
I know
with
Amrish
complete
wants to make a
regulations.
point. I know Amrish wants to
Tanvi,
make a point.
one shot.
But
Just give
yes,
me
quick
10
response from
seconds.
Vivek Reddy. Yeah.
Yes, Tanvi, I think Mr.
Clyde,
Cyril is
Clyde.
pointing about
Clyde.
Clyde is pointing. Clyde, sorry, Mr. Clyde. Yeah. Mr. Clyde is pointing about Maharashtra having not. This reminds me, Maharashtra having not sent the virus anywhere. Well, I think Maharashtra became such a focal point for mushrooming of the virus that Maharashtra not only sent it inter-district, which it has blocked now, like China sent it throughout the world, Maharashtra sent it throughout India.
I think
You know,
Okay.
Karnataka-
I don't want to go there. That's not the point.
This is a political
We
slugfest, but I
are
think you
talking
can I come
about
in?
unlocking
right
here,
now.
please, gentlemen.
Yeah,
There is
please.
really no
Yes.
point.
Tanvi, can I-
Yeah, please,
Karnataka
let's
can.
maintain the decorum.
No
I can
blame
say a
game,
lot
no
of things
blame
if I
game.
want.
Yes.
Tanvi, can I come in?
Please.
Yes, Kovai, I'm coming to you. But
1,000 cases
first
per
up,
day we got
Amrish
from Mumbai.
Arora.
Mr. Reddy, I can say a lot of things.
Let's
So,
take a breather from political
have
fights.
contributed.
before this becomes
That's a
into a
great
BJP
No,
Congress
Yeah,
fight,
I
yeah,
said
yeah.
we should
be a
thank us.
restaurateurs fight.
Amrish.
Listen, guys, right now restaurateurs are shut, Clyde. Please help us open, okay? You want to regulate, you want to trust our associations. All restaurants are part of some association of the other, Clyde, okay? Please don't make it just because BJP started in Karnataka, so Maharashtra Congress should not start or Shiv Sena should not start. Let's not have that. Today, all people are struggling. All my staff is struggling to come back to work. They need money. We can give them employment. We are just holding it back for some reason I can't understand. We've discussed everything. Please start this economy. Trust your associations. Trust us. We'll regulate. You don't have the manpower. We have the manpower. And every restaurant is shut today. That's the only business that's shut. First priority should be to start that on a national level, and only Maharashtra restaurants are shut. So, Clyde, we need you out there.
Can I please reply?
Yes,
then?
yes.
Can I please reply?
Yeah, Clyde.
Tanvi, can I please reply?
Yeah. Go ahead, Clyde. Can you hear me?
Yeah, I can hear you now.
Yeah.
See, I think, Mr. Arora, let me tell you one thing. I assure you one thing. Right in the beginning, I assure you one thing, that we are with you. Ways will be...
Oh, there seemed to be a problem with Clyde's network. I'm going to come back to him the minute we've got him back. But let me go back to Kovai Sathyan, who wanted to make a point, and then I have a question for Mr. Suresh Khosla. Yes, Kovai.
Yeah, to the panelist, respectable panelist, Mr. Reddy, Clyde, or the person representing the restaurant association and the other panelist, one size doesn't fit for all. Everybody knows it in India. The best situation would be like how far a state is prepared in terms of its healthcare ecosystem to handle this pandemic will answer everything. You open up restaurants or you open up manufacturing sector, you give 100% attendance or whatever it is. The end of the day, what will happen is if any employee, for that matter, a brown collared employee or any person in the rural areas, rural parts of the state gets COVID positive, and he'll definitely look forward for the nearest primary healthcare center run by the government. So it is the onus of the government to get prepared to that extent. So every state has to consciously take that approach that once my infra is ready, my healthcare ecosystem infrastructure is ready, then you think about taking a call on each and every parameter that comes on the priority list. So once we talk about interdistrict and interstate movement, quite naturally the hotels has to be open for accommodation. So it cannot be like, you open up and let the people stay on the roads. It is not going to happen. So next tourism will come in. So and since you have opened the hotels in urban sector, why don't you let us give it in this place? So it's all a chain of reactions in economy that one is interconnected with each other that will follow. Our only request is when everybody will stand up at one point and say, it is the responsibility of the state. They should have got the healthcare in place first before allowing us to do all these things. It is easier for them to say after 2 months. So let us not get into that point wherein we'll start pointing fingers at each other.
So how far along
to fight
is Tamil Nadu from reaching that point, or at least a major part of Tamil Nadu in terms of healthcare infrastructure?
Yeah, we are almost there. So now we are leading by example. We are doing at about 65,000 tests a day, and yes, the mortality rate is lowest in the nation at about 1.6%. And as the panelist was mentioning, there was one panelist who said, I think Clyde said that we have opened up public transportation with regulation. We have not opened up public transportation yet. We are still under the private players are opening. Only cars are being played around in the interdistrict. So we have carefully monitored the situation. We have a certain amount of understanding how it is performing. Let me remind to all the panelists, even if you take the national average of contact tracing, it cannot be more than 10% per COVID positive cases. So look at the kind of stress and load this 3 million or 4 million positive cases has given us to the entire healthcare system. Doctors have overworked, frontline workers have overstressed, overworked, and everybody in the healthcare ecosystem have pushed their limits. And if you want to add more to it, and it will break. So you have to take a conscious approach based on the confidence that each and every state has got in himself with respect to healthcare.
Okay.
So I think Tamil Nadu is there almost prepared, but we are taking a cautious approach.
Tamil Nadu says they're almost prepared, taking some precautions. Just 1 minute, Clyde. I want to bring in Dr. Anand Bhan on this aspect. Dr. Anand Bhan, the idea from day one we said for the lockdown was to prepare our healthcare infrastructure, to have our policies in place. From what you've seen, especially in the bigger states with larger population, have we managed to reach a certain comfort level? Or rather, are the state governments even doing that? Are they even intent on building it? Tamil Nadu claims they are, but what about others?
Yeah, so I think almost all states have tried. I wouldn't say that they haven't tried, but the fact is that a lot of that effort has been very much focused on infrastructure.
Yeah.
Just to say that you have now hospitals, you might also have more ICUs, more ventilators, etc. available. But almost everyone has struggled with getting the right amount of human resources to run these augmented number of facilities. You cannot produce doctors overnight. You cannot produce nurses overnight. You cannot produce paramedical staff overnight. So yes, you can do some retraining, but you will always struggle if you. And that's where I think the challenge is that, whatever experiments we try with unlocking, with opening up the economy, it could put pressure on a health system which is already fragile, which is already struggling at the seams in many places. And any rapid increase in number of cases could actually lead to some kind of a collapse at the local level, at the state level, and potentially at the national level. So that's the risk element we need to talk about. And responsibility cannot be only individual. Responsibility obviously falls at the government, but then also at organizations, at institutions, at restaurants. One rogue institution can spoil the whole continuum of control on the number of cases which is rising. We've seen that happen in a few cities where you have establishments which open up beyond a certain deadline, do not follow social distancing, allow for parties to happen, and then you have a cluster of cases which has been created, which easily spreads because typically these will be younger people, not many of them asymptomatic or mild symptoms, and they take the infection back to their households. Elderly people getting infected, and then you have a whole chain of infection spread happening in that community. So again, responsibility is important, but then you need to have regulation as well. And we need to be extremely careful in ensuring that we have a health system which is on top of things and not struggling to try to control and respond to a situation caused by opening up too soon and too ambitiously.
Okay, in fact, Vivek, Reddy, comment on this aspect, because it's not just about creating healthcare infrastructure by saying, oh, we have added so many beds and we've added so many ventilators. Where is your healthcare staff? Where are your doctors who will now also have to, apart from COVID, manage non-COVID cases? If there is a further spike in the number of cases in Karnataka, is your healthcare system prepared for that?
Well, I think, Tanvi, in every city we saw initial hiccups of varying degrees. But if you look at the overall system, broadly, the statistic can be corrected by the doctors on the panel or other experts on the panel. Broadly, we have 30% and 70%, the government and the private involvement in healthcare structure. I think broadly, I may not be exact, but broadly it is that the government is in charge about 30% of the structure and 70% is led by the private establishments. Today, we find that with the COVID outbreak, after the initial hiccups where private players took some time to get into the mainstream operations, COVID operations, I think once they have come into the mainstream challenge to fight this COVID war, the whole system has geared up. In each of these cities, we find a far better scenario. People's initial struggle for beds were there, but once the whole system was rationalized and everybody got involved, the whole private and government got involved, I think it's much better off. And we find that non-COVID cases were reported less. But now, even as those non-COVID cases come, nevertheless, they are a priority. Even they too are being catered to by different sections of the hospitals. So overall, what the Harvard, I think John Hopkins predicted that, and many experts, international experts predicted, that healthcare system of India was very frail. And, due to these frailties, it will just shatter and fall apart. I think that scenario is not seen 5 months down the line. And that is the great thing about the entire healthcare system in India. We need to appreciate that across the states. And they have done a wonderful job in restoring the confidence of citizens to go about their economic activity. And there, India excels or stands apart from the rest of the world. We are not looking at a scenario like Europe, where the most developed countries could not afford healthcare to their citizens.
Okay, very quickly from Mr. Khosla. Mr. Khosla, as we look at the next step of reviving or restarting some kind of growth in this country, what is it that your sector really would need from the government in terms of both health safety and, of course, support to restart the business?
Today, the economy is really down, and we need a good support from the government side, so that our transportation, our logistics, we can revive and we can come back to, we can be on the tracks again. And hello?
Right, I can hear you. Go ahead, please.
Hello?
Mr. Khosla, we can hear you. Go ahead, please. Okay, some audio issue there. Unfortunately, I don't think he is able to hear us, but I'm also completely out of time. So I'm going to thank all of our panelists for joining us. A conversation that factors in our health and our health safety and security as far as COVID is concerned. Conversation that also factors in the economic aspect of what's going on. Because all of this is necessary when policies are made. Some states have opened up more, the others believe that they have far too many cases right now, and some amount of regulation and restriction is still required. At the end of the day, viewers, we need to keep multiple factors in mind. Are we ready with our healthcare? Are we ready with enough number of doctors? Are we doing enough testing and surveillance as we open up? And when we do open up, do some of our policies really make sense? If we are saying it's okay for malls to open, for people to go and shop, then do we really think there is a problem for restaurants to open up? While we may allow the restaurants to open up, are we sure we want the pubs and bars to open up in times of a pandemic, in times of an economic slowdown as well? Many factors to be kept in mind as these policies are made. Most of all, we have to keep in mind that life cannot be absolutely stand still. We need to start devising ways of living with the COVID, yet restarting our lives, restarting our economy. Thank you so much for joining us on this conversation.